Hello, good afternoon. My name is Daisy Valderas and I'm an FMP student. Today I will be conducting the head-to-toe assessment. So I wash my hands, I've introduced myself to the patient. We're going to be doing a head-to-toe assessment on you today. Is that okay with you?
Yes.
Okay, so basically on this test, we're pretty much just going to go over all of your systems. We're going to assess your head, eyes, ears, nose, throat. Then I'll go down to your respiratory system, cardiovascular, your gastrointestinal. We'll be checking your abdomen, and then we'll be finalizing with your neuromuscular and your musculoskeletal system. Okay?
Okay.
Okay. So first I would start on his head. I would make sure there's no asymmetry, no visible lesions. I'll be palpating as we go. Is that okay as well?
Yes.
Okay. So just checking for any bumps or lumps, any masses, skin texture, no signs of hair loss, no thinning of hair. Okay. No pain anywhere?
No.
Okay. So then for his facial structure, it's symmetric. As far as his skin, I don't see any pustules, any discoloration. So eyebrows are nice and full. They're symmetric. So now we'll be assessing a few of his cranial nerves. So I'm gonna have you raise your eyebrows. Okay, make an angry face. Okay, puff your cheeks. Okay, very good. Now I'm gonna have you close your eyes, and then I'm gonna be touching very gently. So you tell me now when you feel like I'm touching. Okay?
No. 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 No.
Okay, very good. Okay, so now I'll be also, now that we're here on your neck area, I'll be assessing your lymph nodes, your trachea, and your thyroid gland, okay? So I'll just be going down your cervical lymph nodes. Okay. Your trachea is midline, no deviation. Your thyroid gland. Okay. Swallow. Okay. And then as well the TMJ swallow. Very good. Okay. So now we'll start assessing your eyes. So we'll start by assessing your visual fields. So what I'm gonna have you do is you're gonna look straight at my finger and then you're just gonna follow it, okay? Now look straight at my fingers, and I'm gonna wiggle my fingers over here. You tell me when I'm wiggling them, okay?
Okay. No. 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 No.
Okay, very good. And now I'm gonna be shining a light to your eyes. I'm just assessing, making sure that your eyes are constricting to the light, okay?
Okay.
So just look straight at me. Okay, very good. So pupils are equal, round, reactive to light and accommodation. Okay, so now I'll be inspecting his eyes. His sclera is nice and white. I don't see any signs of jaundice. Conjunctiva is pink and moist. I don't see any dryness, any discharge. Okay. So I don't have a device to assess for the red light. It would be pretty much something similar to this. I would just be able to look into the veins of your eyes, okay?
Okay.
Okay, so now I'm gonna have you do what is called this Snellen eye chart. So what I'm gonna have you do is cover one of your eyes, and then with the other eye you're gonna read for me the first letter here.
E.
The second one.
L T. F P H.
Mm-hmm.
O L C F.
Okay. Can you read this one?
DHJBS
Okay.
EPTZO
Okay. Now cover your other eye. Again. Mm-hmm.
ELTFPHOLCF DHJBS EPTZO.
Very good. You don't use glasses?
No.
Okay, very good. Okay, so now we're gonna assess your ears. So basically here I'm just seeing that they're symmetric, they're concave. I don't see any lesions, bumps, or any skin tears. Skin is intact. So now I'm going to be assessing another cranial nerve, and I'm going to be doing what is called a whisper test. So I'm just going to whisper a word in your ear and you tell me what you hear. Okay?
Hap. 5.
Okay. All right. Very good. So now there's another test that I would do with the tuning fork, and it would just assess the hearing in pretty much the conduction in your hearing, making sure that the hearing is equal bilaterally. Okay. So now I'm going to be assessing your ears with this device. So I'm just making sure that it's pearly white. I just see cerumen. I don't see any foreign objects, any lesions. Okay, pearly white, no redness, discharge, swelling. It's very good, okay? Okay. Okay, so now for your ear, so it looks symmetric, septum is nice and straight, no deviation noted. I'll be looking inside of your nose, just making sure that I don't see any little bumps, tumors, any foreign objects. I also don't see any nasal discharge. Okay, very good. So here I will be able to assess another cranial nerve. It's just pretty much, I didn't prepare for this, but it's just assessing your sense of smell. Okay, do you have any difficulty smelling?
No.
Did COVID mess around with any of that stuff?
No.
No? Okay. Okay, so now I'm also gonna palpate your sinuses. Just tell me if they're tender. No tenderness?
No.
No tenderness?
No.
Very good. Now we're gonna go ahead and assess your mouth. So I'm gonna have you stick out your tongue. And here I'm checking your tongue. It's nice and pink. I don't see any cuts, anything like that. So I'm just gonna be bringing this down. Say ah.
Ah.
So here I can assess that the uvula is rising. I'm gonna assess your gag reflex. Sorry. Now I'm gonna be moving your tongue from the sides. Okay, very good. Push against my lip. Okay. Now to the other side. The other side over here. Bring it to your right. Okay. Bring it up. Bring it down. Okay. I'm here assessing your gums as well. He has braces, but no missing teeth. No chipped. Everything looks really good. It's nice, moist, and pink. Your lips look nice and moist. No ulcers. I don't see any cracking. Okay, tongue strength was intact. Do you have any difficulty swallowing?
No.
Okay, very good. Okay, so now we're gonna move down to your thorax and your lungs, okay? So here I can see that his just sit up straight for me. Okay, so so I can see that his chest is symmetrical. I don't see any variable chest. I don't see any respiratory rate. I also see it regular. I don't see any use of the accessory muscle while he's breathing. I'm gonna be auscultating your lungs, okay? Do you have any history of asthma or
No.
any breathing problems? Okay.
No.
Okay, just take a deep breath. What's going on? Are you okay?
Sorry. Tickled me.
It
Okay.
tickled you, I'm sorry. Okay, I'll go to your back. Again. Well, you're the first patient that gets tickled with a stethoscope.
Yeah. Sorry about that.
That's okay. Okay, so breath sounds were clear in auscultation. I didn't hear any wheezing, no crackles. Lungs were nice and clear. Okay, so now we're gonna be doing just what's called percussion. So should be resonant. Okay. Okay, very good. Now I'm gonna have you kind of sit and look towards your right here. I just want to see that chest expansion is symmetrical. Take a deep breath. Okay. Now I'll be checking confirmatives. Say okay. So as well here his respiratory rate, like I said, is regular. Also his chest, I don't see any nodules, any tumors. Everything is nice and clean. Okay. So now we're gonna move over to your cardiovascular system, okay? So I will be auscultating your carotid arteries, making sure there's no bruit here. I'll be listening to your heart sounds. You have any cardiac history?
No.
Okay. So here, we'll start with your carotids. Okay, no bruit. Okay, so heart sounds, I can hear S1 and S2. I don't hear any rubs or gallops or any murmurs. So now I'll be here palpating your PMI, which will be right here. Okay. So PMI will be in the fifth intercostal space. I as well palpated the precordium for any heaves. Okay. Okay, so now you're not gonna like this one. No, we're gonna be doing the abdomen, okay?
Okay.
So I've uncovered his turd. He's just very shy to be seen in video. But as far as his abdomen, I didn't notice any masses, no skin breakdown. What else? No scars, no striae. Abdomen was nice and intact. So now we'll begin. So I've inspected it. Now I'll be auscultating it. So we'll be starting from his right lower quadrant, moving up and then to the side. Okay? So I'll just be listening to your belly sounds, okay?
You want me to lay down?
Can you?
Yeah.
Here. So bowel sounds were normal active in all 4 quadrants. Now I'll be doing light palpation, so I'll be touching your belly, just very light. You tell me if you feel any pain besides the tickling. No?
Okay.
So now it's gonna be deep palpation. You let me know if you have any pain, okay?
No.
No pain?
No.
Okay, good. Okay, very good. Now you can sit up. There was no tenderness, no rebound tenderness when I was pressing one side. The other one wasn't painful?
No.
Okay, so no rebound tenderness, no signs of appendicitis, no signs of peritonitis as well. Okay, so now what I'm gonna have you do is I'm gonna have you lay actually on your right side. Yes. So with this test, I'm gonna assess your spleen and your liver. Okay.
Okay.
So here. Okay. And then can you lay on your back? No, on yours.
Oh, my.
Here I'm assessing the liver. Okay, very good. You can sit up now. Okay. So, liver was 7 centimeters in the midclavicular line and palpable below the right costal margin. So now what I'll be checking is for CVA tenderness. So I'll be pretty much just percussing your back. Okay, so I'm gonna have you stand up. So I'm pretty much just gonna tap on it and you let me know if you feel pain, okay?
Okay. No.
No?
No.
Okay, very good. Now you can sit down. We're almost done, okay? Yes. Okay, so now we're gonna go over again your neuromuscular and your musculoskeletal, okay?
Okay.
Okay, so tell me your full name and birthday, please.
My full name is Gilbert Quintero, and my birthday is 12/15/1994.
Okay, do you know today's date?
August 11th, 2024.
Okay, do you know where we are?
Yes, in our house.
Okay, do you know what's going on right now?
Yes, you're doing a neuro exam.
Okay, perfect. Okay, so now let's start assessing some of your skills. Would you be able to count backwards from 50 to 0 in increments of 5?
Yes, so 50, 45, 40, 35, 30, 25, 20, 15, 10, 5, 0.
Okay, very good. So now I'll be placing some objects in your hand and you're gonna tell me what it is, okay?
Okay.
You're just gonna close your eyes. Okay, extend your left hand for me. What is it?
Paper clip.
Identify it? Okay. Oh, keep it up here. Another object?
Coin.
Okay, very good. Now with your right hand.
A coin.
Okay.
Paper clip.
Okay, very good. And I'm gonna draw a letter in your hand, and you're gonna tell me what I'm drawing. Okay?
Okay. O.
Okay. Everyone.
S.
Very good. Okay, perfect. Okay. So now I'm gonna tell you two objects, and you tell me how they're related or what comes up to your mind. For example, if I say orange and strawberries.
They're fruits.
Okay, very good. So now I'm gonna have you close your eyes. I'm gonna be tapping here in your arms. You're gonna tell me if the object that I'm using is sharp or dull.
Okay. Dull. 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 Sharp. 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 Sharp.
Okay, very good. Okay, so now I'm gonna have you bring your hands up. Okay, and then I want you to rapidly look at your palms and then look at your hands. Okay, very good. Now I'm gonna have you touch my finger and then touch your nose. Again. Okay, now with your left hand. Again. Okay, very good. Now we're gonna do what is called a heel to shin test. So you're basically just gonna run your right heel through your left shin, and then you'll do the opposite as well.
Okay.
Okay, perfect, very good. Now I'm gonna have you stand up, and I'm gonna check your balance, your posture. I'm gonna have you close your eyes. And this is what is called a Romberg test. So here, we basically just leave you like this for like 30 seconds to a minute, and we just assess your balance. Like you don't lose any balance, coordination. Okay, very good. So I'm gonna assess your gait. You can open your eyes now. I'm gonna have you walk towards the end of the carpet on your heels.
My heels.
And then you're gonna come back on your toes. Okay. Very good. Now I'm gonna have you walk in a straight line, heel to toe. Heel to toe. Heel to toe. Okay. Very good. Very good. Perfect. Now you can take a seat. Now I'm gonna go over your reflexes, okay? So we'll start here with your brachial radial. Okay. Okay, we'll do bicep and tricep. Okay, relax your hand there. Okay, we'll check your knees if let's say we were standing higher than, okay. Okay, perfect. And now we'll do your Achilles. So I'll have you stand up, put your knee on the couch. So let's say you didn't have the shoes, right? It would be right here and right here. Yeah, perfect. Okay, we are almost done, okay? So now I'll be assessing your strength and your range of motion, okay? So we'll start with your shoulders. Push my hands up with your shoulders. Okay, now down. Put your hands in front of you. Raise them above your head. Okay, put them down. Okay, now behind your back. Okay, now in front of you. And crisscross. Crisscross, the other side. Okay, perfect. Now let's assess your wrist. So you're just gonna fan your hands to the opposite sides. And then fan them in. Point them to the ground. Point them to the ceiling. Okay. Now push my hands down. Okay. Push my hands up. Okay. Pull my fingers. Okay, very good. So now we'll do your, I guess I'm gonna have you stand up so I can assess your spine and then your hips. So So here I'm assessing his spine. It's nice and straight. I don't see any curvature. So I'm gonna have you touch your toes, okay? Very good. Now I'm gonna have you bend back as much as you can. Okay, it's not painful.
No.
Now I'm gonna have you bend to the side to side. Okay, very good. And now kind of twist. Just there you go. Perfect. Okay, perfect. Very good. So now I'm gonna have you lay on your back and we're gonna assess your hips, okay?
Okay.
Okay, so here you're gonna bring your knees to your chest. Okay, the other one. Okay. Now you're gonna bring them out. One at a time, yeah. And then I'm gonna have you lay on your sides and then you're gonna bring them out, okay? Out, very good. Okay, very good. Okay, now you can sit. Try to push my hand up with your knee. Okay, up with your knee. Okay, so now I'll be assessing your feet. So I'll have you point your toes to the floor, yeah, not to the ceiling. And here you would pretty much push on my hand. I'll be checking your strength. Okay. Push like a gas pedal. Yeah, there you go. Okay. Bring them up. Push my hand down. Okay. Push my hand down. Okay. So I've assessed range of motion and I've assessed strength all throughout. It was 5 out of 5. And active range of motion. Okay, Mr. Quintero. I think we're pretty much done. Am I missing anything?
No, I think you checked everything. Yeah,
Yes,
I feel
yeah.
great.
Any questions or concerns?
No,
Well, thank you for your cooperation this semester. You were a good student.
thank you.
Thank you.